Okay, so in this first part of lecture, I'd like to talk about complementary alternative medicine, or as it's usually abbreviated, CAM. And so rates of using complementary and alternative medicine, and I'll get more into the definition of this in one of the following slides, but rates are on the rise. And so it's hard to get super recent data on this, but I will show some of the most recent information I could find. But as of 2006, it was estimated that about 54% of Canadians were using at least one type of complementary alternative medicine product or practitioner in the previous year. So this was based on people's self-reports around Canada and whether they were accessing these types of treatments and care. And since then, interest in use has continued to rise. So this graph comes from a more recent study from Canada and looking at rates of complementary alternative medicine use from 1994 to 2010, so going a little bit further past that 2006 estimate that we had on the previous slide. And we can see here, just based on the shape of this graph, that rates are going up. People are increasingly seeking out complementary and alternative medicine over time. And even this is a relatively steep increase just from 1994 to 2010. I think it's interesting if you break this down by cohort. And so what this study did was also look at, we can see this increase over time across all people who were in the study, but we can also break the people in this study down into their different generational cohorts. And so we can have people who were born pre-World War I, who were around during World War II. This is the Generation X. These are the older baby boomers, younger baby boomers, and what we can see is that certainly, particularly among the baby boomers and Gen X, people are increasingly using complementary and alternative medicine as they get older, but this slope is much, much steeper for Generation X, right? So people of younger cohorts are showing a greater increase in use of complementary alternative medicine than people in older cohorts. And so I think this makes sense, right? You grow up around a different messaging and ideas about what makes for good medicine, but I think it's important to see that this trend towards more use of complementary alternative medicine is largely driven by these baby boomer and Gen X cohorts here. Just to move outside of Canada, not to overwhelm you with numbers, you certainly don't need to memorize or anything from this, but this is just looking at rates of use of complementary alternative medicine around the world. Here they're using the abbreviation TCAM. They're including a traditional complementary alternative medicine, but really they're looking at the same thing here, except that here we're operationalizing it as seeing a specific provider or practitioner of complementary alternative medicine. And so here we're not including things that you might do on your own, just seeing a practitioner. And so you can see rates are still quite high. And so looking across all these countries, about 26% of people are engaging in some type of seeing a practitioner of complementary alternative medicine. And their satisfaction with that is quite high, about 72% of people who seek this alternative medicine are satisfied with that treatment across the world. We can look at the rates in the US. So about 21% see a practitioner, and they're about 85% are pleased with that. So you can just see the range around the world. And so I think some of the lowest ones are in Poland and Slovenia in terms of seeing a practitioner of this. But what they're showing here is just around the world, lots of people are seeking out complementary alternative medicine. So what is this, right? I keep referring to this term, but I want to delve into a little bit more about what specifically this refers to. And it really refers to a very diverse group of practices and treatments of different healing therapies. And really, it encompasses everything that's not currently considered to be an integral part of what we consider conventional medical practice, or really the biomedical model, right? It really encompasses most things that we don't consider part of that and are not part of our Western traditional medicine system in terms of the what we do in hospitals and in doctors' offices as part of our typical treatment regimens, right? So it really encompasses everything that falls outside of that. So there's an estimated 300 different types of complementary alternative medicine, at least according to the Public Health Agency of Canada. We can group these into some groupings, right? There's over like 300 different types, but we could think about them in some broad categories, right? There's biologically based approaches. This can include like specific diets, the use of certain herbs or vitamins, right, that are either actually or are believed to have some type of real biological effect on the body and its functionings that leads to better health. There's also what we consider manipulative and body-based therapies, and these are things, where you're being touched and your body is being manipulated in some way, like massage or chiropractic work, right? So that kind of work there, or reflexology, right? You're pushing on or pulling on the body in some way to try to manipulate it in a way that's going to lead to more healing. There's also mind-body interventions, right? And we've talked about these in terms of meditation. This is also, it would include things like yoga and relaxation practices. This can also include spiritual practices that are designed to heal the body. And so this is really taking into account the types of CAM that are really about this connection between mind and body. There's a whole alternative medicine systems, right? And alternative meaning alternative to typical Western biomedical medicine, right? So this includes things like homeopathy and naturopathy, and so these are whole other ways of thinking about how medicine should even work and what are the causes and consequences of pathogens in the body. And so I'll talk a little bit about homeopathy, and you'll also learn some more about that there's a video that will be posted. And so you can see that there, at least from our perspective as health psychologists and people invested in looking at biological factors, there's no evidence that homeopathy has a physical effect on us at all. And so this is what we mean when we're talking about it's a whole different way of thinking about what medicine even is. There's also energy therapies, right? And these are focused on trying to shift the movement of energy in the body in ways that promote healing. So this can be done with like the use of magnets. Crystal healing also includes Reiki, right? So we're actually moving your body in ways to move energy around it to try to promote healing. Can never pronounce it right. Qigong is also a form of that, right, where you're moving your body to shift energy in ways that are designed to promote healing, right? So here I'm just talking about them all in terms of what they are believed to do, but as we'll see in some of the future slides, right, for some types of complementary alternative medicine, there's quite a strong evidence base for their efficacy, at least in some circumstances, and for some other types like homeopathy, there really is no evidence base, or in fact, there's an evidence base that it doesn't work. And so as we'll see, one of my critiques of the research on CAM is that when we include so many different types of procedures and practices under one label, it's really difficult to determine, what the effects are of these treatments when we look at them as a whole group, because we're including so many different things within this category. But so now we've given the definition of CAM, that there's really 5 different broad types. But what are people's motivations for seeking complementary alternative medicine? We said that rates are on the rise, and I think this is particularly interesting given the fact that, at least within Canada, right, we have universal health care that covers what we would consider, traditional biological medicine. So people, for the most part, do have pretty good access to that. We're going to challenge that a bit in the next section of the lecture. But people, especially compared to the U.S. and countries without universal health care, do have access to medical treatment. So why do people seek out these more alternative and complementary means? And so in one of the papers I want to talk about here, they really try to delve into this and differentiate the motivations for why people are seeking out CAM. And they categorize these motivations into 2 broad categories. The first being pull factors. These are things that pull people towards engaging in complementary medicine, things that are appealing and attractive about this type of treatment. And this can be everything from a desire to take a more proactive role in your health, right? So if you can feel like you're doing more if you're engaging in more treatments, or you could be, investigating other types of things you might do and be led to find out about these complementary alternative treatments and be more likely to engage in those. More holistic health beliefs are also associated with an interest in complementary alternative medicine, right? We said one of the sort of failings of the biomedical model, and the fact that we still employ that in a lot of places, is that it really doesn't treat the person as a whole person. It doesn't consider all the psychological and social factors that might also influence health. And complementary alternative medicine practitioners very often are holistic healers. That's one of their goals. And so people who have holistic health beliefs are often drawn towards this type of practice. People are also, this is a related point, very interested in the psychological health benefits as well as the physiological health benefits of complementary alternative medicine, right? They're interested in the relaxation and meditative components as well as physiological efficacy for treating a disease and promoting health. There's also it's really important to look at the other category of factors, which we call push factors, things that push people away from more traditional medical treatments and therefore into complementary alternative medicine. And this is a really important thing to look at because it speaks to some of the failures of the current medical system, right? So things that are bad about that, when people have negative experiences with traditional healthcare, they may turn to complementary alternative medicine instead of that. And so this could be having really strong side effects from typical medical treatment, that they either don't want to get that treatment anymore and want to try an alternative treatment, right, alternative medicine, or they might want to find a complementary approach to help manage some of those side effects of their medical intervention. They also may feel that and for good reason, that the medical model intervention that they're being given isn't effective, and so they may be just seeking other things that could work, and so that could push them towards complementary alternative medicine. Often one of the drives for this is really poor doctor-patient relationships within the traditional medical system, right? So as we're going to talk about in some of the next sections, the way that we've structured healthcare leaves doctors very often extremely pressed for time, not really able to engage holistically with patients or give them the time to really listen to all of their concerns. And so this poor doctor-patient relationship may lead people to, not be interested in continuing to seek traditional medical treatment and turn instead to complementary alternative medicine. So looking at this table here, what we're looking at is really the shift in motivations for seeking complementary alternative medicine over time. So we're looking at people's reasons from 1997, 98, and then again in 2005. And what we're finding here is that the results suggest that people have both of these push and pull motivations, and these readily come to the minds of consumers of complementary alternative medicine. But it seems like the motives, these pull factors, seeing the positives of complementary alternative medicine, that does seem to be gaining strength. And more recent evidence also does suggest that people are finding a lot of appeal in these holistic health practices and seeking those out more and more, both because they're driven away from the medical system, but even more so because they find appealing aspects in these alternative systems. And that's essentially what we're looking at here. So this is patients responded to the item, I use complementary medicine and therapy because, and then how much they endorse each of these things, right? So because conventional medicine has not been effective, people, in 1997, 98, about 41.8% people endorsed that. And then later, depending on exactly how we estimate this, it's between 67 and 50%, so it's gone up. The stars mean this is a significant difference, right? So really, the motivations on both sides have gone up over time in terms of interest in complementary alternative medicine, in terms of both the push and the pull factors. Just wanted to show some more evidence similar to this, and this comes from specifically cancer patients and their motivations for seeking complementary alternative medicine. And all of these participants come from Ontario specifically, right? And so the difference here in this study is really, both that here we're looking specifically, the main difference is really that here we're looking specifically at cancer patients rather than all people seeking complementary alternative medicine, right? So here we're really looking at this subset of people who are seeking it for a specific diagnosis. And so you can see, what percent of participants endorsed these different reasons for why they're seeking CAM. And so really you can see the main reason, 51% of people endorse that they're just trying to do everything that could help with treating their cancer. You can see some of the other reasons, because conventional treatment is too toxic. That would be a push factor. CAM is more true to your beliefs and inner self. That'd be a pull factor. Wanting to take more control of your treatment. And then conventional treatment is too mechanistic, technological, and lacks human touch, right? You can see some of those same themes here in people's endorsement of them. But really the dominant theme being people just really, when you don't have a lot of options, or their traditional treatment may or may not work, people really are willing to try really anything that might help. And so this seems to be one of the primary motivations, particularly when people are sick and are seeking out CAM. Similarly, they looked at, what are the benefits they're hoping to get. The main thing was to help stimulate the body's ability to fight cancer, to help them relax or sleep, and again, to do anything possible that they could try. Those are really the main motivations here. Right? And so I put this up just to distinguish, right? You see a lot, see similar motivations, but also some different ones when people are seeking CAM specifically to treat an illness that they have versus in general, right? You might also seek different types of things. In this study, they looked at cancer patients were particularly likely to try different teas, vitamins, biological agents, whereas in the general population, you see more seeking out of yoga and meditative practices. And so you can just see different types of complementary alternative medicine are sought for different reasons here. There's also some demographics associated with CAM use. And so just on average, if you had to predict who's going to be most likely to seek out CAM use, the people who demographically are most likely to do so are middle-aged women who are highly educated and have a great number of chronic health issues, right? So it's more common among women, it's more common among middle-aged people compared to younger people. It makes sense. You start to accumulate more potential health problems and need to engage in more practices to try to manage those. Highly educated are more likely. And again, the greater number of chronic health issues, right? People really are more likely to turn to CAM when they need it, when they have health issues that they need to cope with. And so this is believed to indicate both this desire and a financial ability to promote health, right? That's really where the highly educated comes in. It seems to be, it's more the association between education and wealth that allows people to access this, as opposed to the education itself, bringing some insight or knowledge about the efficacy of these treatments. And so it's really, again, the drive for complementary alternative medicine seems to be about a desire to promote your health or to prevent deterioration from a disease, and you also need to have the financial ability to seek that out, because this is not usually covered by health insurance, and so you're going to need to pay out of pocket for these types of treatments. And again, it's especially important for chronically ill patients. But importantly, it's not that chronically ill patients are, not getting traditional treatment and are just seeking out alternative medicine. They're also seeking out more traditional treatment, right? Again, you're trying everything. So they're doing more CAM, but they're also doing more regular medicine, right? You're doing everything that you can in these cases to try to treat the disease. So I've posted this video to watch, and this also goes into some more about CAM and talks about some of the concerns around this rising interest in complementary alternative medicine. And I just want to briefly talk about some of these concerns here as well. And I've already touched on this one a bit, but one of the biggest concerns is that when we lump all of these things into this category of CAM, we're including a lot of different types of treatments in this, right? We're including everything from homeopathy, which, just to put it briefly, is the idea that if we distill things that make us sick down into very, very small amounts of that, right? So you basically dilute that in water over and over and over again until there's basically nothing left. The idea is that if you give the person that diluted version of that toxin, that's going to improve their health. And there is absolutely no evidence for the efficacy of this. In fact, there's no biologically plausible mechanism, right? But this is included in the same category as things like acupuncture, where at least for some diseases and for chronic pain, acupuncture has been shown to be fairly effective. And so when we include things that we have no evidence base for with things that we do have an evidence base for, it muddies the waters, right? And so people may have heard about the benefits of acupuncture, and now we're also including in the same category homeopathy, crystal healing, things like that. And so that may lead people to the false belief that these things also work and that there's also evidence for these. And so this is believed to in part account for the rise in interest in complementary alternative medicine, is seeing all of these things as legitimate pathways to treatment, when there really is a lot of variation in the established legitimacy of these treatments. Sometimes it's because, like with homeopathy, we know that it doesn't work, but sometimes the research just hasn't been done yet and we don't know. And so it's not yet a part of traditional medical science because we just haven't done all of the research yet, and maybe it could become so later. And so this is just not a great distinction to talk about traditional medical care versus complementary and alternative medical care. Also, as he makes that point in the video you'll watch, that a lot of things that are often considered complementary alternative medicine can be things like good diet and exercise, and that is things that doctors do recommend. And so there really is it's kind of a false dichotomy here. Another concern is with complementary alternative medicine, it's not subject to the same types of regulations as other medical treatments, right? So whereas for a new pharmaceutical drug to come out, it has to go through lots of regulatory processes and research to be approved. There's lots of restrictions on where and how and to whom that can be sold. There's a lot less regulation for alternative products, and so you can go out and buy certain vitamins and herbal supplements, and there's not the same level of regulation around those. And so you need to be a lot more careful about whether you actually are getting what you think you're getting and at the dose that you think you're getting. And so it doesn't mean that you shouldn't take anything that's complementary alternative medicine but you do want to be careful about the sources of those because they are not well regulated. And so this has led to issues with people getting contaminated or just totally inactive products when they think they're buying something specific. Another just major concern is, some of these treatments may, not do anything but not be harmful, right? So like homeopathy, it has no biological active mechanism. You're just giving people basically water. You've diluted the thing so much, there's nothing in it, and so it doesn't cause any direct harm either, but it can indirectly cause harm when people think that these types of treatments are going to cure them and therefore do not seek other types of treatment that could help them. And so this is when we're concerned, right? When people get false belief in a treatment that has no efficacy, and then they use that instead of treatments that we do know work, that's when we're concerned, right? If you're using this in a complementary way, that's one thing, but when you're using these systems as alternate types of medicine instead of things that we do know work, that's when we become concerned. Right, so my example for that would be, I have a few friends who are interested in crystal healing and engage in that kind of thing, putting crystals on their body, and there's no evidence that that works, at least yet. There's also no evidence that that causes any direct harm to you. So I would be a lot less likely to tell them not to do that. I might tell them there's no evidence from health site that works, but that's your money, that's up to you to spend it on it. But I would become concerned if they were not going to the doctor because they were using this instead. So if they're using it alongside it, it's just inactive, it's inert, it's not doing anything, it's not causing a direct harm. But if you're not seeking out other treatment, then that can be a real concern. And there are also types of complementary alternative medicine that do have a direct harm. These aren't any of the ones we've pretty much talked about so far, but you've probably hear stories on the internet of people engaging in all kinds of weird things, from putting urine drops in their eyes because they have learned that that's a way to treat certain eye disorders, and there's no efficacy in that. And in fact, that's really, really bad for your eyes. Don't do that. That's dangerous, right? So we really depends on whether we know that alternative medicine is effective, and also whether what the potential risks are, and we need to really be considering those. And again, this is where it's kind of a false categorization to lump everything that's complementary alternative medicine into one category, because they can range from being effective to not effective at all to highly risky. So I'm going to stop there, and then I'll pick up in the next section talking more about healthcare system and policy.